Buprenorphine is medication used to treat moderate to severe pain. It is classified as an opioid analgesic and works in the brain to alter the body's perception and response to pain. This medication can be beneficial for those experiencing ongoing pain and can be taken as directed by a healthcare professional. It is important to follow the recommended dosage and timing for optimal pain relief. This medication is administered through an injection into a vein or muscle by a healthcare professional, as prescribed by your doctor. The dosage will be determined based on your medical condition and how you respond to the treatment. For the best results, it's important to use this pain medication at the first signs of pain. Waiting until the pain has worsened may decrease the effectiveness of the medication. If you have been using this medication for a long time or in high doses, suddenly stopping it could lead to withdrawal symptoms. Your doctor may gradually decrease your dose to prevent withdrawal. Let your doctor or pharmacist know right away if you experience any withdrawal symptoms. Over time, this medication may not work as effectively. If you find that it's not working well for you, talk to your doctor about it. While this medication helps many people manage their pain, there is a risk of addiction, especially for those with a substance use disorder. It's important to use this medication exactly as prescribed to lower the risk of addiction. If you have any concerns, ask your doctor or pharmacist for more information. If your pain doesn't improve or gets worse, be sure to inform your doctor. Some common side effects of Buprenorphine Hcl 0.3 mg per milliliter injection Syringe Opioid Analgesics (IR) with all antitussive opiates include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, headache, sweating, redness, itching, or irritation at the injection site. To prevent constipation, it is recommended to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, but be sure to consult your pharmacist for the right type. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. However, if you experience any serious side effects such as interrupted breathing during sleep, mental/mood changes, difficulty urinating, or signs of liver damage, seek medical help right away. Additionally, if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you experience any other effects not listed, contact your doctor or pharmacist. Buprenorphine can be addictive and may cause breathing problems, especially when you first start taking it or if the dose is increased. It's important to use the smallest effective dose for the shortest amount of time to reduce these risks. Talk to your doctor or pharmacist about having naloxone available to treat opioid overdose, and make sure your family knows the signs of an overdose and how to respond. Avoid using alcohol or other drugs that can cause drowsiness or breathing problems while taking buprenorphine. If you experience severe breathing problems, lightheadedness, drowsiness, or difficulty waking up, seek medical help immediately. Pregnant women should discuss the potential risks and benefits with their doctor before using buprenorphine, as it may slightly increase the risk of birth defects and cause withdrawal symptoms in newborn babies. Use the smallest effective dose for the shortest possible time during pregnancy to lessen these risks. Before using buprenorphine, be sure to let your doctor or pharmacist know if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to inform your doctor or pharmacist about your medical history, especially if you have any brain disorders, breathing problems, gallbladder, kidney, or liver disease, mental/mood disorders, or a personal or family history of substance use disorder. Buprenorphine may affect the heart rhythm, causing serious symptoms that require immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that can cause it. Low levels of potassium or magnesium in the blood may also increase the risk of this condition, so it's important to talk to your doctor about using buprenorphine safely. This medication may also cause dizziness or drowsiness, and alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery until you can do so safely and to avoid alcoholic beverages. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, there may be an increased sensitivity to the side effects of this drug, such as confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, this medication should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. Additionally, this drug can pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are certain pain medications, naltrexone, and samidorphan. The risk of serious side effects may be increased if this medication is used with other products that may also cause drowsiness or breathing problems. Make sure to tell your doctor or pharmacist if you are using other products such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines because they may contain ingredients that cause drowsiness. Additionally, this medication may interfere with certain lab tests, so be sure to let lab personnel and all your doctors know that you use this drug. If a person has overdosed on Buprenorphine Hcl 0.3 mg per milliliter injection Syringe Opioid Analgesics (IR) with all antitussive opiates, and is experiencing serious symptoms such as passing out or difficulty breathing, it's important to administer naloxone if available and then call 911 immediately. If the person is awake and not showing any symptoms, it's crucial to contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, a slow heartbeat, and even coma. It's imperative to seek medical help as soon as possible in the case of an overdose. It's important to remember that this medication is for your use only. It is not legal to share it with anyone else. Buprenorphine Hcl 0.3 mg per milliliter injection syringe is a medication used to treat severe pain. It is an opioid analgesic, which means it works in the brain to change how your body feels and responds to pain. This medication should only be used as prescribed by a doctor. It is important to follow the dosing schedule provided by your doctor to get the most benefit from this medication. This medication is typically injected under the skin or into a muscle, as directed by your doctor. The dosage is based on your medical condition and response to treatment. For the best effect, this medication must be used regularly. Do not increase your dose, take it more frequently, or use it for a longer time than prescribed. Properly stop the medication when so directed. This medication may cause withdrawal reactions, especially if it has been used regularly for a long time or in high doses. In such cases, withdrawal symptoms such as restlessness, watering eyes, runny nose, nausea, sweating, muscle aches may occur if you suddenly stop using this medication. To prevent withdrawal reactions, your doctor may reduce your dose gradually. Tell your doctor or pharmacist right away if you have any withdrawal symptoms. When used for an extended period, this medication may not work as well and may require different dosing. Talk with your doctor if this medication stops working well. This medication is only administered in a hospital, clinic, or doctor's office and should not be kept at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.